ICH, intracranial hemorrhages. So first of all, there has to be some difference between hemorrhage and hematoma. So what do you mean by hemorrhage? The hemorrhage is basically a small and thin layered bleed. It is small and thin layered. But hematoma is large and space occupying. It is basically space occupying bleeding. So this is the basic difference between hemorrhage and hematoma. Now, as a rule, some amount of moderate force, if applied to head, it can cause severe intracranial hemorrhages, or greater force. If force is of much intensity or greater force to head, may not produce any hemorrhage, So this is the rule, that moderate force can apply to head. If applied to head, it can cause severe hemorrhage, but greater force, if applied to head, may not produce that much hemorrhage. So there is no relation between the two. Now, first thing to understand is there are different kind of intracranial hemorrhages. So first we will discuss about the basic anatomy of the skull as well as brain. So suppose this is underlying brain, this is brain, and there is one layer, that is arachnoid, this is durameter, then there is skull, and there is diploid. So outer table and inner table are either side of this diploid. So this layer is pyometer, that is just adjacent to the brain. Then the second layer is arachnoid, and this layer is durameter. So if any bleeding or a collection of blood below the durameter, this is durameter, below the durameter, this is subdural hemorrhage. If the collection is above the durameter, this is epidural or extradural hemorrhage. If any kind of collection of blood or bleeding or hemorrhage just below the arachnoid matter, over here, this is known as subarachnoid hemorrhage. So these are three kind of hemorrhages. But if there is some bleeding or some collection of blood in the parenchyma of brain, this is known as intraparenchymal bleed or intraparenchymal hemorrhages. So this is basic difference between all kind of hemorrhages. So first of all, we will cover extradural hemorrhage, extradural or epidural hemorrhage. So as we all know that this layer, this is known as durameter. It is one of the strong meninges, and it is gray blue in color, grayish blue in color. This is known as durameter. This is strong, tough structure. It forms the sinuses. So dura is basically forms the sinuses, which are the draining channel for the venous blood of brain and dura and bones of skull. So basically durameter forms various sinuses. Now the various causes of the extradural hemorrhage. So what are the common causes of extradural hemorrhage. First is the almost exclusively it is traumatic. So most common cause of extradural hemorrhage is trauma. Now what happens as a result of some impact? Suppose there is one impact. Now due to that impact, that skull moves relative to durameter. Skull moves relative to durameter, and there is stripping of dura from the bone. Dura stripped off from the bone, and that creates one empty space. Space creation just below the skull over there. This is for EDH, for collection of blood. That's why there is collection of blood in the created space that is known as extradural hemorrhage. So this is the basic mechanism. Now what happens? Blow over squamous temporal bone, so is responsible. Basically what happens over the temporal area of skull, the temporal area, or the that area is known as squamous part of temporal bone. This part is having middle meningeal vessels and mostly middle meningeal arteries. These middle meningeal arteries are the branches of internal maxillary arteries. Internal maxillary artery. So middle meningeal artery is the branch of internal maxillary artery. What happens? There is rupture of these arteries, middle meningeal arteries, and most commonly the posterior branch of middle meningeal artery is commonly ruptured in case of extradural hemorrhage. Now this type of hemorrhage is the least common among all, only seen in 1-3% cases. Extradural hemorrhage is only seen in 1-3% cases of head injury. Now this kind of hemorrhage, extradural hemorrhage, is common in adults between the age of 20 to 40 years, because in very young infants or young individual or very old age, dura is firmly adherent to overlying skull, so that's why less chances of stripping off of dura while impact. So hemorrhage, usually these kind of hemorrhages may not be associated with any fracture, but if in case they are associated with any fracture, so in 90% cases the fracture will be fissured fracture. As we discussed in previous video, fissured fracture is the most common type of skull fracture. So in 90% cases the fracture, in case the EDH or the other hemorrhage is associated with fracture, the most common type of fracture is fissured fracture. Now there are various clots. Atypical limitation as dura is basically what happens. Dura is basically attached, durameter is attached to suture lines, so that's why the typical limitation is there. Extradural is typically limited to certain limits, so clots will be always in certain limits because dura is firmly attached to suture lines. Usually 100 ml, about 100 ml extradural hemorrhage, the volume of extradural hemorrhage is 100 ml, that is commonly associated with fatalities. So 100 ml is fatal. Now the thing is that there can be rapid bleeding, there may be rapid bleeding or immediate bleeding. So if bleeding is rapid, so most likely it is venous, but if bleeding is immediate, So it's most likely combined bleeding, arterial as well as venous bleeding. So bleeding can be immediate bleeding, can be rapid bleeding. Now what happens in about 50% cases, the second hemorrhage or subdural hemorrhage or subarachnoid hemorrhage or intra parenchymal bleeding may be there. So it is associated with various other kind of hemorrhages also. Now the extradural hemorrhage is associated with something is known as lucid interval in about 30 to 40% cases, in about 30 to 40% cases. But lucid interval is not seen if injury is very severe. So what is the concept of lucid interval? What happens immediately after head injury? There is immediate unconsciousness. Then after some time there will be a period of consciousness. Then again there will be a period of unconsciousness. So this period between two periods of unconsciousness is known as lucid interval, and it is seen in 30 to 40% cases of extradural hemorrhage. But it is only seen if injury is mild to moderate. It is never seen in case of severe injury, severe head injury. Why? Because what happens in case of severe injury, there is immediate bleeding, and immediate loss of consciousness. So there won't be any period of consciousness between the two period of unconsciousness in case of severe head injury. So this is lucid interval. Now the second hemorrhage is subdural hemorrhage. So basically subdural space is a very narrow. This space is very narrow and it contains small amount of fluid. That fluid permits the relative moment between dura and arachnoid matter. Now this space is crossed by various veins, various communicating or auxiliary veins that connects the dural venous sinuses with the skull. So now this is the space that is known as subdural space. What happens? This subdural hemorrhage is most commonly due to rupture of. There are various causes. The first cause is the rupture of these veins. These veins are ruptured, so that's why there is collection of blood in subdural space. Rupture of these parasagittal. These are known as parasagittal breathing vein. Parasagittal breathing or communicating veins. So this is most common cause. Now the second cause can be due to rupture of dural venous sinuses, due to rupture of dural venous sinuses. The third cause can be the this kind of SDS can be seen in case of cerebral trauma. Cerebral trauma or tumor can be seen in case of aneurysm. Aneurysm can be seen in the patients on heparin or warfarin therapy. So these are various causes of subdural hemorrhage. Now this bleeding, this subdural hemorrhage is common than EDH. It is common and it is commonly seen in children and old age population. Now SDS is can be seen in case of trivial trauma. Trivial trauma. It can be seen in case of trivial trauma. It is mostly not associated with any kind of fracture or unconsciousness. Unconsciousness. So it is not associated with fracture and unconsciousness. What happens in about 70% cases? In about 70% cases, this SDH is due to fall or assault. Due to fall or assault, and in about 25% cases, it is seen in case of road traffic accidents. This kind of hemorrhage, this subdural hemorrhage, is more in alcoholics, and old age populations, as we have discussed. Now, the fatality, the volume of fatality, about 100 to 150 ml of SDH is fatal. Now, the SDS is commonly over the upper lateral surface of the hemisphere, the cerebral hemisphere. Suppose this is the cerebral hemisphere, so it is mostly over the upper lateral aspect of cerebral hemisphere over there. Now, what happens? The small amount of SDS may be spontaneously absorbed. So depending on that, there are various types. Like if the collection of subdural hemorrhage is acute, immediate, so this is known as acute SDH. If the collection is immediate, if the collection is going to take several days to 2-3 weeks, that is known as subacute. But if collection takes weeks or months, and this is known as chronic. So these are the different types of SDH. Now, as shown in the picture, the subdural hemorrhage is basically, this is the durameter, and this is the skull cap. So after removing the skull cap, we have noticed this is a durameter, and on removing in that durameter, this is subdural hemorrhage. This is the collection of subdural hemorrhage over the one of the hemisphere, cerebral hemisphere. So this is known as subdural hemorrhage. Now, fresh subdural hematoma can be easily washed off as compared to SH. So how to differentiate the SDH with SH, subarachnoid hemorrhage? First we'll discuss SH, then we'll discuss how to differentiate between SH and SDH. So now the third type of hemorrhage, that is known as subarachnoid hemorrhage. Subarachnoid hemorrhage. It is almost exclusively always traumatic. It is most of the cases it is due to trauma. Almost always traumatic. It may involve, the person may involve various arguments, fights, and person may suddenly collapse and die due to SH. Now what happens? The pyometer is not a true membrane. The innermost layer is the pyometer. That is not a true membrane. Basically, it is basically a meshwork of glial fibers. It is a meshwork of glial fiber, and it is inseparable from underlying brain. So it is basically a meshwork of glial fiber that cannot be separated from the brain. Now the space between the pyometer and arachnoid, suppose this is pyometer and this is arachnoid matter and this is underlying brain. The pia is firmly adherent to brain, and this is the space that is known as subarachnoid space. Now that contains various blood vessels, cranial nerves, and networks of various connective tissues. This is a space. Now various causes of SAH. Most common is the rupture of these veins near sagittal sinus. So rupture of veins near sagittal sinus. Now the other causes can be lacerations, or contusions of brain. It can be seen in various contusions and lacerations of brain, and can be simply due to rupture of Bary's aneurysm. Bary's aneurysm. In most of the cases, in about 95% cases, the aneurysm is the type of Bary's aneurysm. It is basically the defect in the media of vessels, the defect in the tunica media of arterial wall. Arterial wall that leads to formation of aneurysm. Now, what happens in case of the spontaneous hypertensive patients? There may be some spontaneous subarachnoid hemorrhage in person with severe hypertension due to rupture of these microaneurysms as the bifurcation of a small intraparenchymal arteries or vessels. So this is known as Charcot Bouchard's Bouchard's aneurysm. Charcot's Bouchard's aneurysm is seen in hypertensive patients. There is spontaneous rupture of these aneurysms that leads to formation of SH. Now, what happens during assault or physical assault or the emotionally active stages? There is increased catecholamine. There is increased catecholamine. These leads to the increased level of catecholamines are responsible for increased BP, and at that time the weak aneurysms may rupture. So there is a rupture of weak aneurysms. Now, the traumatic SH, traumatic subarachnoid hemorrhage over base of brain can be seen by the lacerations of the internal carotid, vertebral, basal, or vessels. And at the base of the brain, this is the base, there are various vessels, vertebral vessels, then there are anterior, middle, and posterior communicating and all. So, due to rupture of these vessels, there is SAH at the base of brain, and that can be immediately fatal. That can be immediately fatal. Even more than 30 ml of this SH is fatal. Now, what happens? These vertebral arteries are injured due to overstretching at axial atlanto-occipital joint. There is overstretching of these vertebral arteries that leads to the hemorrhage at this area at the base of brain, and that can be seen due to direct impact on the neck or the cervical vertebrae. Now, the SAH, the subarachnoid hemorrhage, it's as shown in the picture. This is the SAH, subarachnoid hemorrhage, which is just above the pyometer. This is the SH all over. And how to differentiate? Suppose there will be a patch or collection of SDH. So if SDH is fresh, we can wash it. We are able to wash it out. So if the hemorrhage is washed off, or we are able to clean it with a wet cotton or gauze, so this is SDH, subdural hemorrhage. But if we are not able to wash it or clean it and it looks like this, so this is SAH. So this is the method of differentiating SAH from SDH. Now, this type of hemorrhage, the SH is the most common. This is the most common type of intracranial hemorrhage, SH, and mostly it is venous in origin. Now, something about intraparenchymal, intracerebral, intracerebral hemorrhages. So they may be found on the surface or in the substance of the brain. These kind of hemorrhages can be seen on the surface of the brain or can be in the parenchyma of the brain. Now, what happens? These kind of hemorrhages may be due to capillary rupture, capillaries. What happens? There is a softening of the wall, vascular wall due to anoxia, or there may be some altered thrombotic mechanism, coagulation pathway. There may be sinus thrombosis, There may be fat embolism and all. These are the conditions, some of the conditions associated with intracerebral hemorrhages. Now, spontaneously, these can be seen in the region of basal ganglia due to rupture of lenticulostriate artery, due to rupture of lenticulostriate artery at the level of basal ganglia. This can be seen. Now, traumatic intracerebral hemorrhages are also common. These traumatic hemorrhages may result from coup or counter coup injuries, counter coup mechanism, and most commonly these are seen in the frontotemporal region, frontotemporal regions, and they are maybe these hemorrhages are associated with skull fractures. Now, something known as intraventricular hemorrhage, intraventricular, intraventricular bleed. These are small intraventricular hemorrhages seen in all kind of craniocerebral injuries. So, intraventricular hemorrhages are mostly seen in all kind of injuries, and most likely they are due to fall and any kind of traumatic injuries. Now, non-traumatic bleeding are also common seen in alcoholic or any kind of physical assault. Usual source of these hemorrhages is the same artery, lenticulostriate artery. This artery is the branch of middle cerebral artery. So lenticulostriate artery is the main source of intraventricular hemorrhages. This is the branch of middle cerebral artery. So far we have discussed about various hemorrhages. The first is the extradural, then SDH, then SH, then the intracerebral hemorrhages. So the most common, the commonest type is the SH. This is commonest, and the most common cause is trauma. This is trauma. Now, how to differentiate between SH and SDH? We just discussed. This is important question. Now, the something is known as lucid interval. This is medically very important for EDH as well as SDH. What happens in case of lucid interval? The initial unconsciousness is due to the shaking or sudden shaking. This condition is known as concussion. This condition is known as concussion. What happens after this period of concussion? There is gain of consciousness. Gain of consciousness. Then again there is loss of consciousness. This is the point where actual bleeding is occurring. There is actual collection of blood is collecting, and that is responsible for this LOC. So now as a rule we have to go for radiological investigations. So just rule out all cases of head injuries or road traffic accident head injuries. Just go for radiological investigations to rule out any bleeding or hemorrhages. It is medically very important, and keep the person under observation at least for 24 hours. This is rule of thumb. So at least keep the patient under observation at least for 24 hours. So this is all about cerebral hemorrhages. Thank you so much. Thank you.